and welcome to the Respiratory System subsection, a supplement to your Chapter 12. Your respiratory system headings are arranged by body area from nose to lungs. Different headings start at the nose, go to sinuses, larynx, tracheum, bronchi, lungs, and pleura. The respiratory system subheadings that you may encounter. For each body area, you may have one or more of the following subheadings: incision, excision, introduction and removal, removal of foreign body, repair, destruction, endoscopy, and other procedures not already listed. First, you need to start out by finding the body area that we're working on. Under that specific body area, then you want to find the procedure that was done. You need to determine the approach that was used, whether it was open or an endoscopic procedure. If the procedure is endoscopic, you will want to look for the instrumentation used, whether it be direct, indirect, with use of an operating microscope or use of a fiber optic scope. Your medical terminology, once again, plays a very big role and comes in very handy. Remember some suffixes that you'll be seeing: ectomy, meaning a cutting out or surgical removal of; an otomy, cutting into; oscopy, viewing through a scope; oplasty, surgical reforming of; or ostomy, surgical creation of an opening from the inside of the body cavity to the out. First, you want to read your op note carefully to determine what was done and on which side. Then you want to read your CPT notes completely to determine if the procedure that you're trying to code, if the description is coded unilateral on one side only or bilateral on both sides. The instruction notes will direct you to use a modifier to specify. If the procedure was done bilaterally, you'd use the modifier 50, or if the procedure was done on one side only, you would want to use the modifier LT for the left side or RT for the right side. This is an example taken right out of your CPT coding book, so you just need to be careful, as I said, what you're reading. 30110, excision, nasal polyp or polyps, simple, would normally be completed in an office setting, and this is noted in your CPT book. 30115 is excision of nasal polyp or polyps, extensive, which would normally require the facilities available in a hospital setting. Both of the above codes are similar, but they are different. Under each code, you will also find the following description where it says, to report bilateral procedure, use modifier 50. On your endoscopic procedures, you want to report the appropriate endoscopy for each anatomic site that was examined. The other thing you need to remember is that surgical endoscopies always include the diagnostic endoscopy when it is performed by the same physician. What this means is that if the procedure starts out as diagnostic, the physician's going in to look to see what's going on, they encounter a problem and decide to surgically take care of the problem they found, then it would become a surgical endoscopy, and the diagnostic portion of it would be included in it. If you look at the code 31231 in your CPT book, you'll find the following. It says nasal endoscopy, diagnostic, and it also says unilateral or bilateral, and it says separate procedure. Separate procedure means, again, that it can only be coded when it's done by itself. In this example, it says unilateral or bilateral, so the diagnostic endoscopy wouldn't matter whether you were doing it on one side or both, it would be the same code. In this instance, you would not add the modifier 50 if you did it bilateral, nor would you add left or right if you were doing it on one side or the other, because it doesn't matter. Okay, that's it for now on the respiratory system. Hope that helps out a little bit, and once again, happy coding.